worked for 40 years in the emergency department, staff nurse, manager. I thought I knew all the symptoms of a heart attack. Mine were a little different, so I was a little surprised by this. When the pain started, I kind of attributed it to a GI symptoms and started taking some Tums. I had gotten a little nauseous, and when the pain kept getting worse, that's when I started to worry. Around 11 o'clock, the pain got real severe. It went from my mid-chest through to my back. I became very short of breath, and that's when I got scared. So I asked my husband to call 911. Well, the ambulance came very quickly, and Inspira medics did an EKG right in my house. They told me it looked like I was having a heart attack.
Lynne arrived immediately to the cardiac cath lab from the emergency department, where she was confirmed to have a STEMI, a large anterior wall myocardial infarction. We do our procedures via the wrist in most patients to lower their complication rate. We were able to open her artery very quickly with a drug-eluting balloon and stent. Medical science has confirmed that opening an artery involved in a STEMI quicker confers a better outcome. We at Cooper strive for the lowest possible door-to-balloon times for both inpatients and for transfers. In Lynne's case, she was opened door-to-balloon in 65 minutes, which is well below the standard, which is 90 minutes, and one of the best averages here locally in South Jersey.
As a nurse, we were always taught the symptoms that men usually get. Left-sided chest pain to the left arm, crushing chest pain, elephant sitting on your chest. I didn't have that. I had mid-chest pain. It went to my back. I got very short of breath and weak. I was surprised that the pain kept escalating. On a scale of 1 to 10, it was a 12. When I woke up after the procedure, I was in CCU and the pain was all gone. I felt great. 2 days later, I went home.
Sometimes women do present differently than men. The most common symptom in women is still the midline chest pressure, as it is for men, but oftentimes women have additional symptoms. They might feel sick to their stomach, they might feel nauseated, they might have pain in the stomach. Oftentimes they may have pain that radiates to the back. What I suggest to women is, especially if you have risk factors, these are symptoms you should be aware of and check them out, whether it be on an urgent basis or just staying in touch with your doctor to see if additional testing is needed.
The cardiac cath lab team and Cooper Cardiology is very happy to collaborate with Inspira Cardiology. It's an excellent collaboration in that they know the team that will take the advanced care, such as us here at Cooper, for their very sick patients. They are excellent clinicians that recognize the acute nature of the disease and know who to call and know how to transfer patients to the advanced center here at Cooper.
Since Lynne's been discharged from the hospital, I've seen her in the office. We're actually monitoring her blood pressure, cholesterol, and blood sugar. She has started cardiac rehab, and we're hoping for a full recovery.
Cardiac rehab is an opportunity for a patient who's experienced a problem with their heart to exercise in a controlled environment where we can monitor their heart rhythm, their heart rate, their blood pressure, and talk to them if they're experiencing any symptoms that they're concerned about. It allows patients to maximize their performance status in the face of having had a cardiac event and gets them to their point of maximum functionality so they can resume their life and enjoy it.
I think more than anything, I like to enjoy myself a little more than I'm used to. Let the little things go by the way and just enjoy what life is bringing and be much more positive. I would tell women, know your risk factors. See your physician regularly like you should. We tend to take care of others and not ourselves. If something happens and you're worried about it, then do something about it. Call 911. Be sure.